Let's start with this question. A woman undergoing elective cholecystectomy for symptomatic gallstones. During the surgery, surgeon encounters unclear anatomy due to severe inflammation and callets. So you understand, whenever we are doing a cholecystectomy, what we need to see is the critical view of safety when you are dissecting the Callet's triangle or the hepatocystic triangle. So in that case, if you are having difficulty, what should you do? Should you just keep doing things? Or do you do something which is called as some rescue techniques like a timeout? So what do you do in these? There are some bailout things which you can, so that you can avoid injuring any important structure if the critical view is not ascertained. The first one, proceed with clipping and dividing the structures as visualized. This is an absolutely no. This is the incorrect answer. This is not a bailout procedure. Convert to open, yes. Whenever you have a doubt, one of the ways is do an open cholecystectomy. If you are having too much difficulty, have no shame. You are okay if you avoid the procedure. Remember, patient safety is first. And you can sometimes perform a subtotal cholecystectomy where a little bit of the gallbladder may be left behind if you are not able to attain the critical view. Now let me show you what is given in Bailey. These are the bailout techniques you may have to do if you are facing difficulties in a cholecystectomy. You can abort the procedure, convert to open. These were in the choices. You can perform a subtotal cholecystectomy, but there are some more things you can do. One is you can do a rescue where you put a tube in the gallbladder, that is called a tube cholecystostomy. Like, you know how we do feeding gastrostomy, something similar. You put a tube in the gallbladder, bring it out from the abdomen, later do a cholecystectomy, maybe when the inflammation subsides. And of course, you can do a fundus-first approach for cholecystectomy. These are the rescue procedures, bailout procedures you must know for entrances and also if you are going to become a surgeon.